Hello, my name is Chaeeun Kim from Seoul National University. Today, I will introduce my research on patient-centered potassium monitoring for chronic kidney disease patients. Chronic kidney disease affects approximately 850 million people worldwide. These patients are at high risk of hyperkalemia. It means elevated potassium level, which can cause fatal arrhythmias or sudden cardiac arrest. Therefore, accessible and reliable potassium monitoring is essential for patient safety. However, current potassium testing is still mostly hospital-centered. Patients often need hospital visits, venous blood draws, and center laboratory analysis. This creates a time gap between sampling and reporting, which may delay timely intervention. Most importantly, patients still lack a reliable option for independent potassium monitoring at home. So, first, we clinically validated a portable potassium monitoring platform using a disposable test strip. We evaluated the system in 40 hemodialysis patients using finger prick blood samples. The results show strong agreement with conventional laboratory measurements, demonstrating the feasibility of self-monitoring potassium levels outside hospital settings. Then, second, we developed a calibration-free potassium sensor based on a PK and POX enzyme cascade integrated with a laser-induced graphene electrode. This ampermetric platform converts potassium-dependent enzyme activity into a current signal. It showed reliable potassium quantification over the physiological range of 2 to 8 millimole with reproducible performance. Also, each of the studies was published in Clinical Journal of the American Society of Nephrology and Biosensor and Bioelectronics. Together, these two studies connect immediate clinical feasibility with next-generation calibration-free monitoring. So, the impact of this work is to make potassium risk visible before it becomes an emergency. For CKD and dialysis patients, potassium ion levels can fluctuate between hospital visit and dialysis session. Accessible monitoring can help detect silent hyperkalemia risk earlier and support better self-management in daily life. With finger prick testing, patients would not always need conventional venous blood sampling. And with calibration-free biosensing, the measurement process could become simpler for non-expert users. Together, these approaches may help bring potassium monitoring closer to everyday patient care beyond the hospital. So, in summary, my research aimed to transform potassium monitoring from hospital-centered testing to patient-centered care. This work is not limited to laboratory sensor development. It is based on a clinically oriented POCD platform and aim to move potassium ion monitoring closer to practical home-based use by patients. By integrating calibration-free biosensing, this approach can reduce user burden and support future patients can use translation. Ultimately, I hope to this work will help make potassium risk visible before it becomes an emergency. Looking ahead, I hope to further develop this bridge between biosensing technology and patient care through doctoral levels research in a global research environment. Thank you for your attention.